There is a number that most men carry in their heads, a number they've never actually measured, never actually verified, but somehow believe defines them. It shapes how they feel after intimacy. It feeds their confidence or quietly erodes it. It influences their anxiety, their sense of masculinity, and in some cases, their willingness to be vulnerable with a partner at all. And the extraordinary thing is, that number is almost certainly wrong, not slightly off, not a rounding error. Significantly, measurably, scientifically wrong. Today we're going to talk about something most people assume they already understand. The actual biology and data behind male sexual performance, specifically how long intercourse typically lasts in real couples, not in films, not in exaggerated conversations, not in the distorted funhouse mirror of online content, but in controlled, real-world research. And what the science reveals is going to challenge nearly everything you think you know. Before we go there, it's worth pausing to ask a question that rarely gets asked. Where did your beliefs about this come from? Think about it seriously for a moment. Most men absorb ideas about sexual performance the same way they absorb ideas about body image or success, passively, through repeated exposure without ever questioning the source. A movie scene here, a conversation there, a platform designed to maximize engagement, not accuracy. Over time, these fragments harden into something that feels like fact, a personal benchmark, a silent standard. And the cruel irony is that the standard was never grounded in anything real to begin with. This matters enormously because psychological research on sexual health consistently shows that performance anxiety, the fear of not meeting an imagined standard, is one of the most significant drivers of actual sexual dysfunction in men. The expectation itself creates the problem, which means understanding what's actually typical isn't just trivia. It is genuinely therapeutic. It has the potential to dissolve years of accumulated, unexamined pressure. Let's start with what researchers actually measured. A landmark study involving more than 500 heterosexual couples from 5 different countries approached the question of sexual duration in a way that's almost never done, rigorously. Couples were asked to use a stopwatch during penetrative intercourse over a period of 4 weeks, recording the elapsed time from initial penetration to male ejaculation. This specific measure has a clinical name, intravaginal ejaculation latency time, often abbreviated as IELT, and it became the clean, objective variable that researchers analyzed across a large and geographically diverse sample. The results were striking, not because they revealed something alarming, but because they revealed something profoundly ordinary. The median IELT across all couples in the study was approximately 5.4 minutes. Some couples recorded times as short as a few seconds, others extended to nearly an hour, but the vast middle of the distribution, where most couples actually lived, clustered well under 10 minutes. The average hovered around 5.7 minutes, under 6 minutes. Read that again if you need to, under 6 minutes. Now compare that to what men believe. When men are surveyed about their expectations, the ideal duration they imagine, what they aspire to, what they fear falling short of, tends to land around 16 minutes. Some estimates push higher. When asked to guess what's typical for other men, they estimate around 9 minutes. Both numbers are significantly higher than the real median. Men are judging themselves against a standard that is more than twice what reality actually looks like. This isn't a small discrepancy. This is a fundamental mismatch between internal belief and external reality, and it's being sustained by a cultural environment that profits from insecurity. Understanding that gap, really sitting with it, is the beginning of something important. The variation across countries in that same study is also worth examining because it tells us something interesting about how biology and culture intersect. Turkish couples in the study had a median IELT of around 4.4 minutes. Couples in the United Kingdom recorded the highest average at close to 10 minutes. Spain, the Netherlands, and Turkey all clustered in different ranges, suggesting that while the biological mechanisms of ejaculation are universal, the way they express in lived experience is shaped by a complex mix of factors: stress levels, relationship dynamics, cultural attitudes about pleasure and performance, and even diet and lifestyle patterns that influence arousal physiology. There's a biological explanation worth understanding here, and it goes deeper than most people realize. Male ejaculation is not a voluntary act in the traditional sense. It is a neurological reflex controlled by a spinal center that integrates signals from the peripheral nervous system, the brain's limbic system, in which governs emotion and arousal, and a cascade of neurotransmitters, most notably serotonin. The ejaculatory threshold varies naturally from person to person based on genetics, receptor sensitivity, baseline neurochemistry, and arousal state. In other words, the speed with which a man ejaculates is substantially hardwired. It is not purely a matter of willpower, technique, or manliness. It is physiology. Research into the neurobiology of ejaculation has identified that serotonin plays a particularly critical role. Higher serotonin activity in certain neural pathways appears to delay ejaculation, while lower activity accelerates it. This is precisely why selective serotonin reuptake inhibitors, a class of medication primarily developed for depression, have been studied extensively as a treatment for premature ejaculation, with strong evidence of effectiveness. The brain chemistry that governs mood and the brain chemistry that governs ejaculation overlap in ways that are still being fully mapped, which means that for some men, what feels like a performance problem is actually a neurobiological pattern that has nothing to do with desire, attraction, or effort. This is important to hold alongside the cultural narrative that frames duration purely as a matter of control, stamina, or masculinity. Biology does not operate on those terms. Biology has its own logic. Now let's introduce the perspective that tends to get left out of these conversations entirely: what women actually experience, want, and prioritize. Here the data gets more nuanced because female sexual satisfaction is genuinely multidimensional in a way that male ejaculatory timing simply cannot capture. Research consistently shows that for most women, penetrative intercourse alone is not the primary pathway to orgasm. Studies suggest that somewhere between 60 and 70% of women require some form of direct clitoral stimulation to reach orgasm, meaning the clock-measured duration of penetration is, for the majority of women, a secondary variable at best. What women report prioritizing when asked in large surveys and qualitative interviews tends to cluster around emotional connection, feeling desired, communication about preferences, and sufficient overall intimacy, which includes but extends far beyond penetration. A survey of over 4,000 women asking about preferred duration of penetrative sex did return an average preference of around 25 minutes, which is considerably longer than typical male IELT. But the key phrase is penetrative sex in the context of a full intimate encounter, not penetration alone in isolation. The distinction matters, and it points to something that data cannot fully capture: the quality of attentiveness, presence, and reciprocity that defines a satisfying experience. The gap between what men perceive as the ideal, 16 minutes, and what typical couples actually experience, under 6 minutes, creates a specific psychological burden that researchers have begun to study directly. Men who significantly overestimate what's normal tend to report higher rates of performance anxiety, lower sexual self-esteem, and greater relationship dissatisfaction, not because their actual performance is inadequate, but because their subjective benchmark is divorced from reality. The experience of a 5-minute encounter that genuinely satisfies both partners is evaluated as a failure by a man measuring himself against a fabricated ideal of 16 minutes. The sex itself hasn't changed. Only the interpretive framework has, and that framework is causing real psychological harm. This is sometimes called reference class neglect in behavioral psychology, the tendency to evaluate personal experience against a distorted or inaccessible comparison group. Most men don't discuss sexual duration honestly with other men. The conversations that do happen tend to involve exaggeration and performance in their own right. So the reference class people use to evaluate themselves is assembled from unreliable, incentivized sources rather than from actual representative data. Changing that reference class, introducing real numbers, real medians, real variation, has a measurable effect on anxiety and self-perception. There's another dimension worth exploring, which is how age affects ejaculatory timing and what that means for men across different life stages. The relationship between age and ejaculation latency is not linear or straightforward. Younger men, particularly those in their teens and early 20s, tend to have shorter IELTs on average. Their ejaculatory reflexes are highly sensitive, their arousal systems are running at high intensity, and their nervous systems haven't developed the kind of learned regulation that comes with sexual experience. Interestingly, some studies suggest that IELT actually increases slightly through a man's 20s and 30s as familiarity with a partner, reduced novelty-driven arousal, and greater psychological comfort all contribute to extended latency. Then, in later decades, a different dynamic emerges. As testosterone levels gradually decline and overall arousal intensity moderates, the urgency that drives rapid ejaculation in younger men softens. None of this is deterministic. These are population-level trends with enormous individual variation. But understanding the arc helps contextualize why sexual timing changes over a lifetime and why those changes are normal rather than alarming. Stress, sleep deprivation, and metabolic health also intersect with ejaculatory function in ways that are underappreciated. Chronic stress elevates cortisol, which suppresses testosterone production and disrupts the delicate neurochemical balance that regulates arousal. Poor sleep has been shown in controlled studies to reduce testosterone levels significantly, even over short periods. A few nights of disrupted sleep can measurably alter the hormonal environment that governs sexual function. Metabolic conditions, including insulin resistance, cardiovascular risk, and chronic inflammation, all affect vascular function, which in turn affects both erectile quality and arousal intensity. What this means practically is that a man's sexual performance at any given moment is not just about what happens in the bedroom. It's a downstream expression of everything happening in his body and his life. Diet, movement, sleep quality, and stress management are not abstract wellness concepts. They are direct inputs into the biology that determines sexual function. For men dealing with what clinicians define as premature ejaculation, typically characterized as ejaculation occurring within approximately 1 minute of penetration, consistently and against the person's wishes, with associated distress. The picture is more specific and warrants more targeted attention. Premature ejaculation is the most commonly reported male sexual concern globally, affecting an estimated 20 to 30% of men at some point in their lives to a clinically meaningful degree. Its causes are varied. In some cases, there's a strong genetic and neurobiological component. The ejaculatory reflex is simply calibrated more sensitively than average from the outset. In others, anxiety, early sexual experiences, relationship dynamics, or conditioned behavioral patterns play a dominant role. In many cases, it's a combination. Evidence-based approaches to managing premature ejaculation have advanced considerably. Behavioral techniques, including the stop-start method and the squeeze technique, have been studied for decades and show meaningful benefit when practiced consistently. These techniques work by gradually retraining the nervous system's arousal ejaculation threshold through repeated controlled exposure. Topical desensitizing agents applied before intercourse reduce peripheral sensitivity and have demonstrated effectiveness in randomized controlled trials. Pharmacological interventions, particularly short-acting SSR, is taken before intercourse, have robust evidence behind them. And psychological therapy, particularly cognitive behavioral approaches and sex therapy focused on anxiety reduction and communication, addresses the mental component that often maintains the pattern even when the biological threshold is workable. The point is, if this is something that causes genuine distress, real evidence-based options exist. It is one of the most treatable concerns in sexual medicine, and it responds well to appropriately matched intervention. What gets less attention is the opposite end of the spectrum, delayed ejaculation, defined as persistent difficulty reaching orgasm despite adequate stimulation. This affects a smaller but significant proportion of men and tends to carry its own psychological weight. Socially, delayed ejaculation is sometimes misread as an asset. Lasting longer is culturally framed as desirable. But for men experiencing it as a source of frustration, disconnection from their partner, or inability to reach climax at all, it's distressing in its own right. Its causes include certain medications, SSR is being a common culprit here as well, psychological factors including anxiety or dissociation during sex, and in some cases neurological or hormonal contributors. Like premature ejaculation, it responds to appropriate evaluation and treatment. The key is not to normalize distress simply because the symptom pattern doesn't fit the cultural script of what a problem looks like. There's a philosophical dimension to all of this that rarely gets space in health content, and it deserves a moment. We live in an era of optimization, biohacking, performance metrics, quantified self. The cultural pressure to measure and improve extends into intimate life in ways that can actually undermine the very thing being pursued. Sexual intimacy at its best is not a performance. It is not an event with a scoreboard. The neurological and psychological systems that generate arousal, pleasure, and connection are exquisitely sensitive to the evaluative gaze. When you're watching yourself, measuring, comparing, grading, you're activating the prefrontal cortex in a way that interferes with the limbic system engagement that makes sex feel good. This is the basis of what sex therapists call spectatoring, stepping outside of your own experience to observe and judge yourself. And it is one of the most reliably joy-destroying things a person can do during intimacy. Real satisfaction in sexual relationships, the kind that sustains connection and mutual well-being over time, tends to emerge from attunement rather than performance. Attunement to your partner's responses, to your own body, to the quality of presence and communication in the encounter. None of that is measurable by a stopwatch. All of it is cultivated through curiosity, openness, and the willingness to prioritize connection over comparison. The numbers in the research we've explored today are not a standard to meet. They're a mirror to hold up against the distorted standard you may have been carrying. The real value of knowing that the median IELT is under 6 minutes, that most couples in the world are operating in a range you've likely never heard discussed openly, is not to make you feel average. It's to free you from a benchmark that was never real in the first place. Understanding the biology helps too. Knowing that ejaculatory timing is substantially neurological, that it's influenced by serotonin chemistry and autonomic nervous system thresholds, that it varies naturally with age, stress, sleep, and metabolic health. All of this repositions the conversation. It moves it from character to chemistry, from willpower to neuroscience, and that shift carries a kind of permission that many men haven't given themselves before. Your body is doing something enormously complex when you're intimate with another person. It's integrating sensory input, managing arousal, reading emotional cues, coordinating neurological signals across multiple systems simultaneously, And doing all of this while also managing whatever anxiety, expectation, or self-evaluation you've brought into the room with you. That's an extraordinary biological task. Approaching it with some curiosity and compassion, rather than a stopwatch and a grading rubric, tends to yield better outcomes by every measure that actually matters. If there's something specific that concerns you, whether that's timing, function, confidence, or something else entirely, the most productive first step is a conversation with a qualified medical professional. A urologist or sexual health specialist can help distinguish between what's biologically driven and what's psychologically maintained and point you toward the right approach. A certified sex therapist can do equally important work on the psychological and relational dimensions. These are not last resorts. They're what competent care looks like for a part of health that deserves the same serious attention as any other. Here is what we know with confidence. The average man lasts under 6 minutes. That number spans an enormous range across real people in real relationships. Women's satisfaction is shaped by far more than penetration duration. Performance anxiety driven by false benchmarks causes real harm. The biology is more complex and more forgiving than the cultural narrative suggests. And the thing that actually makes intimate life meaningful, presence, attunement, communication, connection, is not measured in minutes at all. You've been carrying a number in your head. Now you know where it came from, and you know it doesn't reflect reality. What you do with that, how much lighter that makes you feel, how differently you might approach intimacy, how much more honest you might be willing to be with yourself and a partner, that's yours to decide. But the science has done its part. The distortion has been named, and sometimes that's exactly where genuine change begins.